Imagine a tiny foal, just, weeks old, seems perfectly healthy one moment, and then tragically found dead or declining incredibly fast the next. This isn't some super rare thing. It's actually the devastating reality of Tyzzer disease. It's a condition that poses this, well, significant and often really mysterious threat to young horses pretty much everywhere. So in this deep dive, we're going to unpack Tyzzer disease. It's caused by this really interesting kind of elusive bacterium called Clostridium piliforme. It was actually known as Bacillus piliformis for quite a while, which is interesting in itself. Our mission today is to basically cut through all the complex information, take a whole stack of research, vet notes, expert insights, and pull out the absolute key nuggets for you. You'll get a solid understanding of this super rapid, highly fatal liver disease, and hopefully gain insights not just into horse health, but also into the broader challenges of fighting these sneaky diseases with pathogens that are just hard to pin down and act incredibly fast. Okay, let's dive into this. It's an intriguing topic, but also, pretty heartbreaking. What exactly is Tyzzer disease, at its core?
Right. At its core, Tyzzer disease is this rapidly progressive, highly fatal condition. It mainly hits foals. And what it does is cause peracute progressive hepatitis. That means incredibly fast, really severe liver inflammation and damage. It's a global problem, too. We see it on farms all over the world.
And the bug causing it, Clostridium piliforme. It sounds like it has some pretty unique characteristics. I know it's gram-negative, forms spores, but that obligate intracellular part really stands out. What does obligate intracellular actually mean for how it behaves and, how we try to fight it?
Yeah, that's key. It means it's basically a stealth agent. It can only replicate inside living host cells. Think of it like a parasite that absolutely has to have that host cell environment to multiply. It can't just grow on its own. And that one characteristic, it creates this huge hurdle for both diagnosis and treatment. For one, we can't easily grow in standard lab cultures, on agar plates like many bacteria. That really hinders traditional research. Plus, a lot of antibiotics really struggle to get inside those host cells to actually reach the bacteria.
Wow, okay. That sounds like a massive challenge right there. And speaking of its uniqueness, that name change from Bacillus to Clostridium, what drove that reclassification? Does it tell us something deeper about this organism?
That's a great point. The reclassification came from using more advanced molecular tools, specifically 16S RNA analysis. It's like looking at the bacterium's genetic fingerprint. And what's really fascinating is that C. piliforme is the only known gram-negative obligate intracellular pathogenic Clostridia.
Wait, the only gram-negative one? Most Clostridium are gram-positive, right?
Exactly. Most are gram-positive anaerobes. This guy is gram-negative and needs to be inside a cell. So it really implies that our usual playbook for understanding or treating other Clostridia infections might just not apply here. It's a good reminder that even within these well-known bacterial families, nature can definitely throw us some curveballs. We need totally different strategies sometimes.
So if it's so picky, hiding inside cells, hard to culture, how does it even spread effectively? And what about those spores you mentioned? How tough are they?
The spores. They're absolutely critical for its survival and spread. They are incredibly resistant. Think heat, common disinfectants. They can shrug off a lot.
Yeah.
This lets them just hang out in contaminated environments, soil, bedding, you name it, for a really long time. Potentially over a year.
Over a year. Wow.
Yeah. And that's why you often see these sporadic recurrences on farms that have had it before. The spores just stick around.
Okay, so spores are in the environment. How do the foals actually get exposed? How do they pick them up?
The main route is fecal-oral, simple and direct. Foals ingest the spores from that contaminated environment. Could be the soil, could be bedding, or even directly from the feces of other horses.
Right, that makes sense. And I've read that adult horses can play a kind of hidden role in this, can't they? Like they're carriers.
Oh, absolutely.
Yeah.
Adult horses often act as asymptomatic carriers.
Yeah.
That's a really important piece of the puzzle. They usually don't show any signs of disease themselves, but they can carry C. piliforme in their gut and shed those resistant spores in their feces.
So the source of infection might not even look sick.
Exactly. It complicates things hugely because you could have this continuous kind of silent reservoir shedding spores and putting young foals at risk.
And foals, well, they do foal things, right? Doesn't their own behavior make them particularly vulnerable around a certain age?
It really does. There's a normal behavior called coprophagy, basically, eating feces. It sounds gross to us, but it's a totally normal developmental thing for foals, especially between about 2 and 5 weeks old. They're establishing their gut microbiome.
Okay.
But that behavioral window lines up almost perfectly with the peak age susceptibility for Tyzzers, which is usually from 5 days up to about 6 weeks, averages around 20 days old. So their natural behavior creates this very direct pathway for infection.
Yeah.
And you can't exactly tell a foal to stop doing it,
Yeah, not really an option. So, okay, beyond just swallowing the spores, what else makes these young foals so susceptible? Are there other factors that kind of stack the deck against them?
Age itself is definitely a big one. We rarely see clinical Tyzers after about 5 weeks. By then, their gastrointestinal tract has matured quite a bit, and their immune system is more developed, so they're generally more resistant.
Makes sense. What about diet? Does that play a role?
It seems to. There's suspicion that feeding nursing mares really high protein or nitrogenous diets might actually encourage C. piliforme to proliferate in the mare's gut, which could then lead to increased spore shedding. So mare's diet potentially influencing foal risk.
Interesting.
Also things like rapid dietary changes for the mare or even putting them out on fresh, lush pasture after heavy rain have sometimes been associated with outbreaks.
And environmental factors, stressors.
Oh, definitely. Stress is a big player in many diseases, and Tyzer's seems no exception. Things like overcrowding, poor sanitation, stressful events like transport or capture, even extreme temperatures or high humidity. Basically, anything that could lead to immunosuppression in the foal can significantly increase their vulnerability.
And then there's passive immunity. That seems absolutely critical. We always hear about colostrum.
It is the first line of defense. Unlike us, large animal babies like foals are born immunologically naive. They have almost zero antibodies at birth. They rely entirely on getting those maternal antibodies, mainly IgG, from high-quality colostrum within the first, say, 12 to 18 hours of life. It's called passive transfer.
So what happens if that doesn't go right? That failure of passive transfer or FTPI?
Well, if that crucial transfer fails or is insufficient FTPI, it dramatically compromises the foal's immune defenses. They're left incredibly susceptible. It's a major, major risk factor for Tyzzer disease and other infections too. It's like sending a soldier into battle with no armor at all.
Okay, so let's say the spores get ingested, the foal is susceptible.
Yeah.
What's the journey inside the body? How does this bacterium cause such rapid, severe damage?
Right. So the ingested spores germinate. They wake up, essentially, in the lower intestinal tract, mostly the ileum, cecum, and colon. They start colonizing there, causing some initial local damage. But the really bad part is when C. piliforme gets absorbed into the bloodstream. That's called bacteremia, bacteria circulating in the blood.
And it heads for the liver.
Straight for the liver. It travels via the portal circulation, which drains the gut, directly to the liver. The liver is its primary target. And once there, it triggers that severe multifocal necrotizing hepatitis we mentioned, basically causing widespread spots of tissue death throughout the liver.
And the neurological signs like seizures or coma that are sometimes seen near the end, is that the bacteria actually getting into the brain?
Generally, no, not direct invasion. Those neurological signs usually show up terminally right before death. They're primarily attributed to something called hepatic encephalopathy. It's a severe consequence of acute liver failure. The liver is so damaged it can't do its job of removing toxins, especially ammonia, from the blood. Those toxins then build up and affect brain function, so it's more of a systemic effect of the liver failing rather than bacteria in the CNS itself.
Wow. The sources often mention this really dramatic presentation, like finding a foal suddenly dead. It sounds like a lightning strike. Can you elaborate on the clinical signs, if any are seen before it's too late?
Yeah, lightning strike is a good way to put it. The onset is peracute, meaning extremely sudden and severe. Very often, sadly, foals are just found dead with no prior signs noticed at all. If signs are seen, they progress with terrifying speed, usually within hours, maybe up to a day or two before death.
And what would those signs be?
Things like profound lethargy, just completely wiped out,
Oh.
a total loss of the suckle reflex, maybe diarrhea, but that's actually less frequent in foals with Tyzers. You might see a very rapid heart rate, signs of dehydration, and icterus, that yellowing of the gums or eyes, signaling liver problems.
Jaundice, yeah.
Exactly, jaundice. Fever can be present, inability to stand, seizures, anorexia. But the problem is, many of these are pretty nonspecific on their own, right? Which makes that early diagnosis incredibly challenging out in the field.
So by the time you see clear signs, it might already be?
It's often already very, very advanced. The disease has often run most of its devastating course, making diagnosis more of a post-mortem confirmation than something that guides live treatment effectively.
Given that speed and those vague signs, how is Tyzer's diagnosed if the foal is still alive? Is it even possible definitively?
Well, a presumptive diagnosis, sort of a strong suspicion, can be made based on the history, the foal's age, the physical exam findings, and initial lab data. But for a definitive ante-mortem diagnosis while the animal is alive, It technically requires a liver biopsy.
A liver biopsy on a critically ill foal. That sounds risky.
It is risky and often not practical given the foal's instability, so it's a major hurdle for confirming it, while there's still a chance, however slim, to intervene.
What about blood work? What clues might veterinarians look for there that point towards Tyzers?
Blood work can be very suggestive. You often see hemoconcentration thick blood from dehydration and hyperfibrinogenemia, which indicates inflammation. The white blood cell count, the leukocytes, might be normal or even low, which can be a bit counterintuitive in severe infection. Low blood sugar, hypoglycemia is common, metabolic acidosis too. And critically, you see those sky-high liver enzymes, things like SDH, GGT, ALP, AST, and hyperbilirubinemia, the high bilirubin causing the jaundice.
Are any of those liver enzymes particularly specific?
SDH and another one called GLDH are considered pretty liver-specific indicators of acute damage. When they're really high, it strongly suggests severe, ongoing liver injury.
Okay, beyond the standard blood panels, are there more specific tests, like to actually find Clostridium piliforme itself?
Yes, absolutely. PCR assays are incredibly valuable here. They can detect the DNA of C. piliforme in various tissues, liver, colon, heart, or even sometimes in feces. This is super helpful because, remember, we can't easily culture this bacterium.
Right.
But there's a caveat with PCR. A positive result confirms the DNA is present. It doesn't necessarily tell you how much bacteria is there or if it's causing active clinical disease right now.
Ah, so a healthy carrier might test positive.
Exactly. A healthy carrier foal, or even the mare, might test positive on PCR from a fecal sample. So you have to interpret those results carefully in the context of the clinical signs.
What about serology? Testing for antibodies against it. Is that useful for diagnosing an acute case?
Unfortunately, not really for an acute case. The disease course is just too fast. Foals often die before their immune system even has a chance to mount a detectable antibody response. So serology might be useful for, say, epidemiological studies looking at exposure in a herd over time, but it's not a practical tool for diagnosing that sick foal standing in front of you.
So it really sounds like the definitive, clear-cut diagnosis often comes, well, after the foal has died, confirming what happened.
That's often the sad reality, yes. Definitive diagnosis is most reliably established through a comprehensive postmortem examination, a necropsy. The gross findings are pretty classic. The liver is usually diffusely enlarged, looks mottled, and has these tiny pinpoint white or yellow spots scattered all over it. Those are the necrotic foci, the areas of dead tissue.
And under the microscope.
Histopathology seals the deal. You see severe multifocal necrotizing hepatitis. And crucially, pathologists can often visualize the bacteria themselves, these long filamentous rods, C. piliforme, typically right at the edge of the dead areas. Special silver stains help make them stand out. It's a very characteristic picture, unfortunately.
This sounds like such a heartbreaking race against time with just a devastating outcome usually. What's the actual success rate for treating Tyzzer disease once it's diagnosed?
It's bleak, honestly. Reports of successful treatment are very, very limited. The success rate is consistently low. And that's precisely why everyone emphasizes prevention so heavily. Once clinical signs appear, the odds are really stacked against that foal.
Why is it such an uphill battle? You mentioned the intracellular nature, but what else makes treatment so ineffective?
Well, several major factors conspire against us. First, as we've discussed, that incredibly rapid disease progression. It leaves a vanishingly small window for any therapy to work. By the time you realize what's happening, the liver damage is often overwhelming and irreversible.
Okay.
Second, yes, the obligate intracellular nature. The bacteria are hiding inside the foal's own cells, making it physically difficult for many antibiotics to even reach them in effective concentrations.
And the culture difficulty.
Right. Third point, because we can't easily culture it. We can't do traditional antibiotic sensitivity testing. We can't know for sure which antibiotic would be most effective against the specific strain infecting that foal. So treatment choices are often empirical, based on what should work theoretically, which is far from ideal.
So if direct antibiotic treatment is so challenging, what kind of supportive care can even be offered? What do vets try to do?
Aggressive supportive care is really the mainstay, aiming to manage the severe consequences of the liver failure and keep the foal alive long enough for its body to potentially fight back, however unlikely. This means things like intravenous fluids, lots of them to combat dehydration, correct electrolyte imbalances, and provide glucose to fight the hypoglycemia.
Okay, fluids, sugar.
Also, parenteral nutrition, basically IV feeding, because they aren't suckling. Anti-inflammatories like ketoprofen might be used. If there are seizures, anti-seizure meds like diazepam or midazolam, though you have to be careful with sedatives like barbiturates or benzodiazepines because the failing liver can't metabolize them properly, potentially worsening the hepatic encephalopathy.
Right, makes sense.
Oxygen supplementation might be needed if they're struggling to breathe, and sometimes lactulose is given to help reduce ammonia production in the gut, trying to lessen that brain toxicity from the liver failure.
And antibiotics, even with the challenges, what's typically attempted?
Broad-spectrum antibiotics that have activity against gram-negative anaerobes are usually the choice. Penicillin is sometimes used, but reports suggest its success rate is pretty low. Tetracyclines, like oxytetracycline, or macrolides, like erythromycin, are often considered because they theoretically have better intracellular penetration. They might be able to get inside the cells better.
But there's a warning with macrolides, isn't there? Especially around the mare.
Yes, a critical caution. Macrolides can cause severe, sometimes fatal colitis inflammation of the colon in the nursing mare if she's accidentally exposed, maybe through contaminated hands or licking the foal. So extreme care is needed if using macrolides on the foal to prevent any exposure to the dam.
So putting it all together, the rapid course, the treatment difficulties, the supportive care challenges, what's the final word on prognosis for a foal diagnosed with Tyzer's?
The prognosis is consistently described as grave, just very, very poor. Most affected foals die within 24 to 48 hours after clinical signs start. And as we said, many are just found dead without anyone seeing signs at all. If you connect this back to the bigger picture, it really just hammers home why prevention is so much more impactful than trying to treat it once it takes hold. It's usually a race that's lost before it really gets started.
Absolutely. So let's pivot to that then. What does this all mean for actually preventing this devastating disease? What are the key strategies, the things people can actually do?
Right, prevention is where the focus has to be. And the number one cornerstone is ensuring adequate passive immunity. That means making absolutely sure the newborn foal gets enough high-quality colostrum, that vital first milk packed with antibodies within the first 12 to 18 hours of life. That window is critical.
And checking if they got enough.
Yes. Monitoring the foal's IgG levels, usually with a blood test around 18 to 24 hours old, is really important. If failure of passive transfer, FTPI, is diagnosed, meaning they didn't absorb enough antibodies, then administering intravenous Ag-rich equine plasma can significantly boost their immune system and give them that essential protection.
Okay, boosting the foal's defenses is key. What about the environment, especially with those super tough spores hanging around?
Environmental management and biosecurity are the next critical layers. Because those spores are so resilient, you have to focus on reducing the load in the environment. This means regular, really thorough cleaning and disinfection of foaling stalls, regular stalls, bedding, everything the foals come into contact with. Though remember, standard disinfection might not be fully effective.
Reducing stressors, too.
Definitely. Minimizing environmental stressors helps keep the foal's immune system strong. So avoiding overcrowding, maintaining good sanitation, minimizing excessive handling or transport, especially for very young foals, and just good general farm biosecurity practices are important too, limiting unnecessary visitor access, controlling movement of horses on and off the property, proper disposal of potentially contaminated bedding or manure. It's all part of reducing the risk.
You mentioned the mare's diet earlier as a potential factor. Is that considered part of prevention too?
It's certainly suggested. The idea is that avoiding very high protein or high nitrogen diets for nursing mares might help reduce the amount of C. piliforme in her gut. If she has less bacteria, she hopefully sheds fewer spores into the environment for the foal to potentially ingest. It's about trying to break that cycle of transmission from mare to environment to foal.
This sounds like a really multi-pronged, vigilant effort needed. Is there a vaccine, anything like that, available to protect foals?
Unfortunately, no. That's a major gap right now. There is currently no effective commercial vaccine available for Tyzzer disease. It represents a significant research challenge. And given C. piliforme's unique nature being gram-negative and obligate intracellular, developing an effective vaccine might require different strategies than those used for other Clostridium bacteria.
And the ongoing research needed, understanding its unique pathogenesis better, and that urgent need for an effective vaccine. That clearly shows where future efforts have got to focus if we want to lessen the impact of this disease on the horse industry. It's clearly a continuous fight against a pretty cunning adversary.
Yeah. And maybe consider this, how the story of Tyzzer disease, with its lightning speed and that elusive nature of the bug itself, how it serves as this powerful reminder of just how delicate that balance between life and death is in early development. Not just in horses, but across all species. It really underscores how every scientific step forward, no matter how small it seems, contributes to protecting the most vulnerable among us, and how constant vigilance, even against threats we can't easily see, is just paramount.